If you go to hospital today and get a brain scan, all the doctors see is structure. How thick your cortex is, how much myelin there is, or is there any visible damage on the scan? But as we all know, many serious mental health conditions like depression or bipolar disorder don't show obvious structural damage on the most advanced MRI scan, even though the person might already be struggling. At the same time, we also know that the brain has its own chemical system. There are things like glucose usage, activity patterns, and all sorts of different receptors that dictate our mood and behavior. However, the two sides of the brain, the structure and the chemistry, are often studied differently. So this makes it hard to understand why someone might have a totally normal brain scan structural-wise, might have a high risk of mental health conditions. And our research tried to piece these two things together. We look at 8 brain maps from previous studies. 4 represent structural properties, and the other 4 describe chemical or functional property of the brain. And with this A map, we try to answer one simple question. Does the A brain maps fall into 2 groups, one structural, one chemical, and if so, how strongly do they talk to each other? And to answer these, we use statistical tools that are designed specifically for brain imaging. Instead of testing each brain region like an independent data point, we use methods that shuffle maps around the brain surface to see what patterns could appear just by chance. That lets us say with confidence which relationship between structure and chemistry are actually meaningful. In the end, we are not inventing any new treatment, nor we are trying to classify a patient's disease, but we are trying to build a clearer picture and association between the physical and chemical layer of the brain. That kind of framework can help future studies understand why some people with almost identical structural scans end up on very different mental health trajectories. And it can guide where to look for better biomarkers and early warning signals in real-world clinical research.